Hi, I'm attorney Gregory Dell, and today Stephen Jessup and I are going to discuss depression and anxiety disability insurance claims. Now, our law firm has handled thousands of disability insurance claims related to depression or anxiety. And Steve, we know that these are some of the most highly challenged disability insurance claims, and the number one reason for that is because of the fact that they're subjective claims. Can you just talk for a minute? What does that mean when I say it's a subjective claim?
Subjective means there's really no way to necessarily prove it. Only a person knows what they're going through, how they're feeling. Even the doctors, it takes a while, some time to get a clinical diagnosis of what the issues are. So it's purely self-report. I could say I'm not feeling well today, but there's really no way to test to see if that's truly the case. So the insurance companies fight them, and I think that's even a reason why you see the limitations in the policies, because it's their way of saying, all right, we at least know there's going to be an end date for where we may be on the hook.
Right, and so I wanted to start this video off right away by talking about the subjective nature of depression and anxiety claims and the fact that that's where the disability insurance companies really take advantage of these claims, because they know there's no diagnostic tests, there's no machine that's going to say, or blood work, it's going to say this person has depression or this person has anxiety. Yet, I think at some point in just about everyone's life, someone's going to experience episodes of depression and anxiety. Unfortunately, there's some people that get chronically ill with depression and anxiety and have that go on for extended periods of time that can last months, years, or a lifetime. Now, you mentioned something briefly just a minute ago about a limitation, and that's why the disability carriers limit benefits. What did you mean by that?
Most, especially group disability policies under ERISA, have usually, sometimes short as 12 months, but the mainstay is 24 months that they'll pay you for any condition that's based on a mental illness, depression, anxiety. So it's their way of saying, since we really have no way to be able to, for you to prove it or us to disprove it, we're just going to cap your benefits at 24 months. They could say, hey, we know you still have issues, you're still having problems, we wish you the best, we don't owe you any more money under the policy.
Right, so, and that's one of the few areas where we see disability carriers will limit a period of benefits, but disability companies have had so many people make claims for chronic depression and anxiety that they've said, look, when we write these policies now, it's only going to be 24 months. Yeah. All right, let's change gears for a second and talk about how do the disability companies challenge specifically these depression claims, and meaning really what types of treatment are they looking for somebody who has a depression or anxiety claim to be undergoing?
Well, if you're only going to whether it be a psychiatrist, a psychologist, a therapist once a month, it's going to be hard pressed to say that's at such a level that's impairing your day-to-day activities, your ability to work. They're looking for course of treatment, frequency. If you are being prescribed medication, if the medication's staying consistent, then they're going to argue, well, things seem to be well controlled on this medicine, or your doctor would be adjusting dosages. In a lot of denial letters, what you'll see is they'll say, we see no clinical evidence. But they never exactly say what clinical evidence they're looking for. Right. And a lot of times, especially when it comes to these types of claims, since it's just a documentation of what the person's telling, if something's not in the medical record, they'll assume that person's not having it. So if they're having a hard time sleeping because they're so anxious, or they can't get restful sleep, the depression is just draining them of that, but it's not in the records, the insurance company's going to take the position, well, you must be sleeping well, you must not be having problems with that. So they're always looking at how well it's being documented in the records.
You mentioned documentation, which is important in any disability insurance claim, not just a depression claim, but unfortunately, because of the nature of the practice of psychiatrists and psychologists, I often find that the record keeping by the doctor, the psychiatrist or psychologist, is very poor. And I've many times called a psychiatrist or psychologist's office and I say, do you have the records for so-and-so patient? And they say, well, actually, I have notes of when the patient was here, but I don't have anything specific because I have a relationship with this patient. I haven't really documented, but I can write something for you. And while that's good that doctor is going to write something for us, it's very, very challenging for that disability claimant to go back and document months or years of treatment that wasn't done at the time they had the treatment. So that's a big problem. So if you have a claim for depression or anxiety, you got to make sure that your doctor is documenting well every time you go. The other thing is, how often have you been unable to read the notes of a psychiatrist or psychologist?
I was going to say, you get it looks like they photocopied a legal pad, and you can't make heads or tail of what's being said. Or a lot of times you'll see where it's random notations in the side, where it's almost like it's the brainstorming of the psychologist or psychiatrist while they're listening to the person. But yeah, that makes it very difficult.
And I understand completely why that happens, because you go to the psychiatrist or psychologist for a treatment session, and you want to have the attention of your doctor while you're talking to them. And you're sitting there talking to them and they're writing away the whole time and not paying attention to you. You kind of feel like you're talking to yourself. So it's a difficult treatment situation for the doctor to really take good notes, but unfortunately the disability insurance company is going to hold you to a high threshold to make sure that your records are legible and document everything that's wrong with you. You also mentioned about medication. I mean, does a claimant have to be under medication for depression or anxiety in order to get approved?
I mean, I don't think it's a definitive you must be, but I think the insurance companies are going to definitely take a position. If your doctor doesn't feel your condition so bad that you need some type of medication, then it must not be that disabling. Kind of the same way they do it with pain conditions. If you're not even on painkillers, then you must not be in a lot of pain. So that's the way they look at it. If there's an omission of it, then you must not be having a problem with it. So I think the way that they look at it, that's probably one of the larger steps.
Right. One of the things that I've seen on many occasions, which is really disturbing to me, is a person's getting treatment for their depression or anxiety, and they say, well, we don't see that you had any inpatient treatment, so you must not be that bad. Have you encountered that situation?
I've come across where they're expecting, like something you'd see in a movie where you need to be hospitalized, Baker Act, something like that, and that's not commonly how it happens. And I think the big thing when you get depression and anxiety claims, not only is it just the feelings and the stress and the sadness, but it's the effect it has on your mental functioning, your ability to concentrate. Anyone who's been under a lot of pressure or have something going on in their personal life, they try to go to work and they're thinking about that, it's hard to concentrate on your work. Now, someone who is clinically diagnosed with it, that's going on all the time for them.
What's even worse about this scenario about the hospital is I've had many claims where a person goes in for inpatient hospitalization, they get out, 5 days later, disability carrier cuts their benefits off and says, well, it looks like you're better. Which is really a ridiculous argument.
Yeah, well, they say, well, it looks like you improved while you were in treatment. Well, that's the point of being hospitalized, to stabilize you, some improvement so they can release you, but it's not saying that you're all of a sudden cured of the problem.
I mean, we could talk for hours about our experience with depression and anxiety claims, but I want to touch on one last area, which deals with when a person's on claim and they're getting paid for depression and anxiety, we often see that the disability insurance company will request that they undergo an independent, or we call a compulsory, medical exam. And often what they'll do is they'll send them to a psychiatrist, and they'll also send them to a neuropsychologist for neuropsychological testing. Can you just talk about that for a minute as to why they're sending a person who's been diagnosed with depression for neuropsychological testing?
Well, neuropsychological testing is going to test any cognitive difficulties or problems you may be having: memory, processing speed, executive functioning. So if you're depressed, a lot of times you will see where there's issues in there. The neuropsychological testing can document that. Obviously, they're sending the person to it with the hopes that it comes back that there's no lapse in any of these problems, and then that's their way of trying to disprove the level of the severity. Neuropsychological testing can, in some ways, in certain cases, not every, provide that objective medical evidence of the depression or anxiety, because the neuropsychologists are obviously very highly specialized. Based on test scores and things like that and the personal history, they can correlate why the functioning is going on. Is it related to depression, or would it be related to, if someone's in pain, the medication they're taking, things along those lines. So that's why the companies want to do it more as a way of hopefully disproving the severity of your problem.
I think the other thing with the neuropsych testing is that what they're really looking for, besides maybe a diagnosis confirmation, is the fact as to whether or not the claimant's what's called malingering or exaggerating. And they're kind of using this neuropsych test as a tool to say, well, we had you examined by a doctor, and while they may have found some indication of depression, they think you're exaggerating or malingering, which basically means overstating your symptoms and prolonging your condition. And then they use that to say, because of the fact that you're malingering, and make it like it's a diagnosis, which it's not, we're going to stop your benefits. Yeah. So anytime, if you're a claimant on claim for depression or anxiety and you get called by a disability insurance company that they want to do an exam of you, that is a major red flag, and you should immediately contact an attorney, and you should also immediately discuss that with your treating physician, because they are hands down going to challenge your diagnosis for depression or anxiety. So if you have a claim for depression or anxiety, and this could also be a claim that's secondary to some other physical condition you're having. Very often, somebody has a physical condition, whether it's their neck, back, shoulders, chronic fatigue, fibromyalgia, whatever it may be, and then secondary to that, you become depressed, which is, I would say, on more than 70% of my claims, I have people have physical conditions and then have secondary depression because it's taken away their ability to do their work. So that's very common as well. And the biggest thing we do with those issues is to try to prevent the claimant from being limited to 24 months, because now they have a depression designation even though their primary condition is physical. So that's a very big issue that we deal with on almost a daily basis.
One of the more common ones for sure.
So feel free to give us a call at any time. We always offer a free consultation, and we look forward to the opportunity to speak with you.